There have been nearly 50,000 COVID-19 cases inside Texas nursing homes and assisted living facilities among residents and staff members since the pandemic began.
And 4,700 lives of elderly residents lost because of the virus inside those facilities. But the KVUE Defenders found problems with infection controls.
And advocates say those numbers could have been lower if more was done to stop the spread of COVID-19. Here's investigative reporter Brad Stryker.
We uncovered hundreds of Texas long-term elder care centers that violated infectious disease control standards during the pandemic. Dozens of them are located right here in Central Texas. What we found leaves families wondering if their loved ones died because nursing homes failed to follow protocol.
I had so many sleepless nights in the months of April and May because I was anticipating getting a call from Riverside saying that my mom had spiked a fever in the middle of the night.
Sissy Sanders' mom lives at Riverside Nursing and Rehabilitation Center in South Austin. Records show 63 residents there have tested positive for COVID-19 and 12 have died. Sissy's mom hasn't caught the virus, but the numbers alone scare her.
It makes me angry and it makes me not have confidence in the management of the nursing home.
The KVUE Defenders have been tracking the spread of COVID-19 inside Texas nursing homes and assisted living facilities since the spring. Now statewide data shows 31,952 residents have been infected with the virus and 4,745 have died from it. That means about 27% of all Texans who died from COVID-19 were in long-term elder care facilities. Those residents were already the most susceptible population to the virus because of pre-existing medical conditions and age. But our investigation uncovered another possible explanation.
Infection control has been a problem in Texas nursing homes for at least the last 5 or 6 years.
Amanda Fredrickson of AARP Texas, a nonprofit group that's been advocating for senior citizens for more than 60 years, said the virus shouldn't have ravaged as many facilities as it did. The KVUE Defenders obtained records from the Texas Health and Human Services Commission. They show 565 Texas nursing homes and assisted living facilities violated infection control standards at least 1,435 times between early March and mid-August. 38 of those elder care facilities in the 12-county KVUE viewing area account for 82 of those violations. West Oaks Nursing and Rehabilitation Center tops the list in Central Texas with 8 violations. In April, inspectors noted the facility failed to establish and maintain an infection control program, and the facility did not keep a resident apart from the others if the resident has an infection that can spread. The KVUE Defenders reported back in the spring how family members were concerned about the safety of their loved ones in West Oaks when confirmed cases of COVID-19 in the facility first surfaced.
It's a serious problem, particularly when we think about a virus like COVID that has such a high mortality rate for this demographic.
Riverside here in Austin, where Sissy's mom lives, has had 3 violations. Back in April, inspectors noted the facility failed to have an infection control program that allows it to investigate, control, and prevent infections, and the facility failed to have and implement written policies for infection control. In a statement, a spokesperson from the company that runs both Riverside and West Oaks said, "We're currently reviewing the information found in the database. In March, all of our facilities implemented enhanced infection control protocols that have consistently been updated as new guidelines from federal, state, and local health authorities change."
Do you think there's a correlation here between so many infection control violations and how quickly we saw the virus spread through and kill inside these facilities?
Absolutely.
Advocates like Fredrickson want lawmakers to step in.
When there are repeated violations and the government hasn't acted, the regulatory authority, including the state of Texas, is not doing its job.
Congressman Lloyd Doggett said he's drafting new legislation which would require monthly reports from the federal government on infection control violations in nursing homes. It would also call for an independent group to look at the data and make policy recommendations.
This was a problem before the pandemic, but with the pandemic, like everything else, it just raises the danger immensely, and it allows the transmission of disease from one person to the other.
We also asked the Texas Health and Human Services Commission for a comment. A spokesperson told us they're investigating all long-term care facilities with COVID-19. They're reviewing infection control and other health practices, making recommendations, imposing citations if necessary, and requiring facilities to comply with health and safety requirements.
This is a requirement for public health and elected officials to take whatever necessary steps to make sure that nursing home residents and staff do not die again.
Congressman Doggett told us he plans to file that federal legislation by January. We'll keep you posted. Meanwhile, we've made it easy for you to check if your loved one's nursing home or assisted living facility violated infection control standards during the pandemic. Just go to this story on our website, kvue.com/defenders, and you can check for yourself the data the state gave us listing all of those violations. For the KVUE Defenders, I'm Brad Stryker, KVUE News.